I'm going to show how we use the REAN HealthGuru app for daily check-in and to track symptoms, vitals, nutrition, etc. When you first open the app, you get a check-in once a day asking how you're feeling. Let's say I indicate that I'm feeling better. Then you get asked, how is your mood? I'm happy. Then how is your energy level? You're able to get off the bed, climb the stairs, exercise. Let me say I am able to exercise. And now I'm done with my daily check-in. You can now keep track of your symptoms. You can mark your symptoms as getting better by swiping left to right, or worse by swiping right to left. And once I'm done with my symptoms, I can then indicate my medications. So I get my reminders of the medications for morning, afternoon, evening. If you want to add another medication, you can go into add medications and you can add a medication. You can also select an icon to remember a particular type of medication. And once you respond to your reminders, the history of the medications can be tracked on a monthly basis. You can also track your vitals, like weight, blood pressure, blood glucose level, blood oxygen saturation, pulse rate, body temperature. And you can track the trends of those vitals that you can share with your provider when you meet them. You can mark your nutrition in terms of what you're eating for breakfast, lunch, and dinner, or a snack. Over time, we'll make it much easier for you to track these just by interacting with text and voice. So for example, I can say my medication, and then it will show that I need to take in medication immediately. So likewise, in future, we will be able to interact. If you're not in a mood to touch a screen and you just want to interact and get responses, you'll be able to do so with either texting or voice recording. There's also knowledge articles that can be pushed specific to a health condition that one can either watch, listen, or read in this knowledge window. If in case of an emergency, by pressing that bottom right button, you can indicate that there is an emergency if you end up having to go to a hospital. Also, there's handy phone numbers that you can have, like a doctor, nurse, a social health worker, and a family member that you can launch a phone call or a text message. You can also upload your records, medical records. In future, we're also going to be adding a capability to be able to comprehend a record. For example, if there is a discharge summary of 50 pages, we make it easy to create a one-page summary of the medications that were given or the symptoms that were exhibited during that admission. So it's an easy way to share that as you go from one provider to another provider. Once the care plan is integrated, as we discussed, you'll start seeing, today you'll see only medication reminders here. But once the care plan is integrated, you'll start seeing actions related to nutrition, exercise, meditation, etc. in this care plan to make it easy for you to go through your care plans. All right. Thank you for attending the presentation and watching the demo.